Imagine waking up one morning and realizing your legs won't move. Within hours, your arms go numb. A few days later, you are on a ventilator, unable to breathe. This terrifying scenario is not just from a movie. It's a real-life medical emergency called Guillain-Barré Syndrome or GBS. In this video, we will uncover how it spreads, why it happens, and how people around the world have battled this mysterious illness. Guillain-Barré Syndrome is a rare autoimmune neurological disorder where immune system mistakenly attacks the nerves. It starts with the weakness and tingling, often in the legs, and can progress into full body paralysis. In some cases, the condition worsens rapidly within just 72 hours. It affects approximately 1 to 2 people per 100,000 every year, but increased clusters have occurred during outbreaks like during the Zika virus epidemic in South America in 2015 to 16. The disease was first identified in 1916 during World War I when two French doctors, Georges Guillian and Jean-Alexandre Barre, noticed soldiers with rapid onset paralysis. They found elevated protein levels in the spinal fluid, but without inflammation, a classic sign of GBS. This discovery became a cornerstone in diagnosing nerve disorder even today. Though GBS isn't contagious from person to person, waves of increased cases have been linked to viral outbreaks. Like in Brazil, 2015 to 16, GBS cases skyrocketed during the Zika virus outbreaks, causing fear across Latin America. In Puerto Rico, the number of GBS cases tripled during the same period. Even during the COVID-19 pandemic, multiple countries including India, Italy, and US reported GBS cases triggered by the virus. These events confirmed that infection plays a huge role in triggering GBS. GBS often starts after a viral or bacterial infection. Your immune system fights off the infection, but then it goes rogue. Triggers include respiratory infection or the flu, Campylobacter jejuni, a bacteria from undercooked meat, especially chicken, COVID-19 or Zika virus. Sometimes vaccines may also rarely trigger it, though the risk is extremely low. Essentially, your immune cell starts attacking your own nerve tissues, mistaking them for invaders. Our nerves are wrapped in a protective layer called myelin. GBS damages this layer and disrupting signals between the brain and muscles. This leads to weakness starting in the legs and arms, difficulty walking or holding things, losing reflexes, and trouble swallowing, speaking, and even breathing. If left untreated, you could end up paralyzed or worse on life support. Patients describe the pain as burning, stabbing, and lightning-like sensation. Muscle cramps painfully, and the mental shock of becoming paralyzed adds to the trauma. A man in the UK who developed GBS after a flu infection said it felt like his entire body was on fire from inside. Doctors diagnosed GBS using nerve conduction tests, spinal tap, and MRI scans. Speed matters. The faster it diagnosed, the better your recovery chances. There is no cure, but treatment can manage the reduced symptoms. Standard treatments include plasmapheresis and IV immunoglobulin. In Thailand and Malaysia, hospitals have become more alert about GBS rose post-COVID, proving the need for global awareness. Recovery is slow and varies. Some recovers in few weeks, other takes months or even years. About 30% of GBS patients still experience weakness even after 3 years. Physical therapy and rehab are crucial for regaining strength. While you can't directly prevent GBS, you can lower your risk by avoiding undercooked meat or unclean water, practicing good hygiene and hand washing, getting early treatment for infection or diarrhea, monitoring post-vaccine symptoms if you are already immunocompromised. Early actions can prevent long-term damage. In rare cases, yes, if not treated quickly, GBS can cause respiratory failure. Globally, the fatality rate is around 4 to 7%, mostly in cases where medical cases are delayed. But with timely support, 85 to 90% of patients survive and most recover fully. In 2020, a 35-year-old software engineer in India developed GBS after a mild COVID infection. Within 2 years, he was on a ventilator, but thanks to early plasma therapy and rehab, he walked out of the hospital in 3 months. Stories like his show that awareness and action can change everything. Guillain-Barré Syndrome is rare but very real. It can turn your body against itself within days, but if caught early, it can be managed, treated, and even beaten. So, if you or someone you know experience unexplained weakness or numbness, don't ignore it. Your body whispers before it screams. Thank you for watching Medical World. Please like, share, and subscribe to stay informed about the medical condition that matters.